Human clinical trial showed that Toco Oats clinically proven to significantly improve and alleviate diagnostic criteria for METS patients. As reported, in Malaysia, roughly 2 out of every 5 adults are METS patients, and many of them are unaware. You may be one without knowing it, or you may become one soon. The prevalence of METS is higher in the urban population and among females, with its risks being elevated with advancing age. What are the diagnostic criteria of the risk factors for metabolic syndrome? In our human clinical trial, the diagnosis of METS was made according to the criteria of NCEP-ATP3, or National Cholesterol Education Program's Adult Treatment Panel 3. There are 5 risk factors contributing to metabolic syndrome: elevated waist circumference, high BP level, high triglycerides level, low HDL level, and high blood glucose level. A collaboration between Gold Choice and Universiti Sains Malaysia after 24 months of human clinical trial concluded that Toco Oats clinically proven significantly improved or alleviated all the major risk factors by lowering BP level, lowering triglycerides level, improving HDL level, lowering blood glucose level. The primary results showed that supplementing with 60 gram daily for a continuous 12-week period in METS patients has been shown to significantly improve and alleviate the following diagnostic criteria: fasting blood sugar reduced by 5.5%, diastolic blood pressures reduced by 4.3%, high-density lipoprotein cholesterol, good HDL cholesterol, improved by 23%, and triglycerides reduced by 11.8%. Secondary results exhibited 3 groups of parameters, namely, peripheral antioxidative capacity, which is answering to the level of antioxidant in one's body, is improved or not, oxidative stress biomarkers is reduced or not, and inflammatory biomarkers, which are reflecting the inflammation status. For peripheral antioxidative capacity, 2 parameters are found to be significant. Total antioxidant capacity, TAC, improved by 6.1%, protein carbonyl, PC, reduced by 6.7%. For oxidative stress biomarkers, parameter on superoxide dismutase, SOD, increased by 7.3%, which is significant. As for inflammatory biomarkers, a total of 4 parameters were found to be significant. They are tumor necrosis factor alpha, TNF-alpha, reduced by 12.8%, HSC reactive protein or HSCRP, reduced by 8.2%, matrix metalloproteinase 3, MMP3, reduced by 18.8%, and finally, interleukin-6, IL-6, reduced by 6.2%. In conclusions, 2 sachets, 60 gram, daily of Tocotrienols incorporated oats supplementation, Bioley Toco Oats up to 12 weeks, improved the fasting blood sugar, diastolic blood pressure, high-density lipoprotein cholesterol, or HDL, and triglyceride levels in metabolic syndrome individuals. The beneficial total antioxidant capacity, TAC, and superoxide dismutase, SOD, levels were significantly elevated, while the protein carbonyl concentration was reduced in the Bioley Toco Oats group. Tocotrienols incorporated oats supplementation lowered the concentrations of multiple inflammatory biomarkers in metabolic syndrome patients, as indicated by reduced tumor necrosis factor alpha, TNF-alpha, histidine-sensitive C-reactive protein, HSCRP, interleukin-6, IL-6, and matrix metalloproteinase 3, MMP3. Supplement groups showed tolerable gastrointestinal side effects, and these effects were well tolerated following prolonged consumption.